A simple cold turns into uncontrollable coughing, vomiting, and maybe even death. This infection caused by bacteria is called pertussis, or whooping cough.
It affects mostly infants. You have that characteristic significant cough. It sounds like a whoop, and it could be very serious until a vaccine was developed. Back in the 1960s, about 1 in every 170 children in the United States would die from whooping cough.
To ensure this disease does not spread, the state of California requires mandatory vaccination for children entering kindergarten through 7th grade.
The whooping cough vaccine is very important because we've had a resurgence in cases in California. In 2006, a new vaccine, Tdap, which is a combination of tetanus, diphtheria, and pertussis, or whooping cough, was developed, and we have been revaccinating school-aged children. Usually infants get the vaccine, and we have also been highlighting vaccination of pregnant women because obviously newborns are very susceptible to this infection and this disease.
Infants should begin a series of 4 vaccinations once they reach 2 months. After age 10, all children and adults should get a booster shot every 10 years. This vaccine not only provides immunity from whooping cough, but also from diphtheria and tetanus, all diseases caused by bacteria that can be deadly.
The takeaway message is prevention. If their children are up to date with their series of vaccinations, and all the household members are, it wouldn't be problematic.
For adults and those with healthy immune systems, whooping cough can be easily treated. But for the elderly and infants, whooping cough can cause seizures and in some cases death. So no matter what your age, be sure you're up to date with your immunizations. The initial set of 4 vaccines for infants through age 10 are known as the DTaP series, while the booster shots are known as Tdap. For more information on whooping cough and for locations of vaccination clinics, please visit longbeach.gov/health.